Ideally, my medical care is a partnership between me and my medical team, and decision making is shared. And today, I want to tell you a little bit about why that is so important to me and what it means for how I live my life. For people working in healthcare, person-centred care can seem like yet another catchphrase. The term brings with it shelves of reference material and long checklists of questions that need to be asked for, or follow-ups that need to be done. It's extra work, basically. But for me, person-centred care means at some point in the future, I will be given a choice about when my appointments happen, so that I can fit them into my increasingly hectic schedule, rather than organise my life around phone calls and appointments with oncologists who are invariably running late. Person-centred care represents the hope that one day patients like me will be able to have breezy conversations with benefits teams who already have their health information on the system, rather than having to fill out encyclopedic forms detailing every single medical trauma they've experienced, in the knowledge that they will also face a brutal assessment and have to prove how incapacitated they are. Next slide, please, Alana. My treatment for primary breast cancer felt very much like being on a conveyor belt with a lot of other people going through the same thing at the same time. There were lots of mistakes made, many of which I could have spotted and been able to correct had I been more actively involved in my own care and had access to my own medical information. We can't really have person-centred care without explaining to patients what their role might look like within that. And there is definitely some work to be done on introducing people into the healthcare system and providing them with tools to support their healthcare professionals optimally. One of those tools for me has to be an easy, ongoing access to my healthcare record. As a patient, I know that I'm dealing with an overstretched and underfunded system, and I often feel like a burden. So being able to access my blood tests, results and scan reports without having to badger and nag a nurse who is clearly already run off her feet would be really useful for me on a daily basis. During my initial chaotic year of treatment, surgical marker clips were supposed to be inserted into my breast tissue before I had chemotherapy to shrink my cancer. Those clips weren't put in. The hospital apologised for their error, but it left me wondering why I hadn't been more aware of what was supposed to happen in that procedure and how I hadn't known that something had been left off the checklist. Actually, nobody realised that mistake had been made until after the 6 rounds of chemotherapy had happened and I was gowned up for the next procedure. Next slide, please, Alana. With easy access to the right information, I could have been an active part of the safeguarding checklist, just as much as the wristbands, the repeated checking of my name and date of birth, the multiple consent forms and paperwork. Person-centred care could be a really effective tool for safeguarding and risk reduction. Imagine how many more mistakes could be prevented if the majority of patients were actively engaged in an ongoing dialogue with their healthcare information and were clearer about what was supposed to be happening to them. When my oncologist shared the news that my cancer had spread in 2015, she was careful to explain that this meant it was treatable, but not curable. I was immediately referred to my local palliative care team, who visited me in my house and helped me, home, and helped me to access some of the financial benefits I was entitled to. My home was not a house, it was actually a boat, and it is still a boat. But given my medical situation at the time, it was really important that the professionals I was dealing with knew that I lived on a boat. I needed them to know details about my personal circumstances, like whether I was caring for children, whether I drove or had access to a car, and what my employment situation was like, so that they could be sympathetic to my very individual needs. These details about my life helped them to think about how they might be able to support me if the treatment they were giving me didn't work. Squeezing a hospital bed and oxygen tanks onto a narrowboat would have been very challenging for them. Those conversations also sifted out some very important details that have continued to be relevant through the many years of successful treatments that have followed. And I feel very lucky in that regard.